Good morning, everybody, and welcome to this morning's webinar as part of Different Strokes Virtual Conference Week. My name is Austin Willett and I'm Chief Executive of Different Strokes, and I'm absolutely delighted that you're able to join us today. We're really pleased that this morning that we're going to be talking about fatigue, and we know that this is one of the most popular sessions that we're putting on this week. I should just point out that this session is being recorded. However, all of you who are watching this in complete anonymity, and no details about yourself will be captured in the recording at all. Nevertheless, we would love to hear from you this morning, so please do use the chat function and the Q&A function. If you're not that familiar with Zoom, if you hover your cursor over towards the bottom of the screen, you'll see that there is a chat function there. So please do let us know where you're watching from, for example, and please do give us feedback on the talk while William's talking this morning. There is also a Q&A function, so if you've got some specific questions, again, please do ask them during the course of the presentation, and then we'll do our best to answer these towards the end. Stroke affects everybody differently, and there are many different effects that people have from stroke, but arguably the most common of them is fatigue. And it's something that we hear from the majority of people that we support at Different Strokes, is how fatigue is such a debilitating issue. We're therefore really pleased this morning to be joined by William Dodonker. William is a research assistant at the Institute of Neurology at UCL, and he's studied fatigue for the last 4 years. And William has had contacts with Janice in our office and many of the other stroke survivors who we support through our online support group. So without further ado, I'd now like to hand over to William.
Hi there, everybody. Good morning. Thank you, Austin, for the introduction, and thanks everybody in the Different Strokes for inviting me to talk about this this topic of fatigue that seems to come up so often among stroke survivors. So I am a research assistant working at the Institute of Neurology at Queen's Square as part of University College London. And I'm simultaneously doing my PhD together with Dr Anna Kuppuswamy as part of the effort lab. So for the last 4 years, I've been working on fatigue. So this is a project we have which is purely trying to understand what causes fatigue in stroke survivors, and then how can we go about coming up with effective treatments for fatigue. So that's sort of the general aim of the entire project. So I just wanted to let you know before we start that I'm going to try to make this sort of presentation as interactive as possible. So the aim is to have every 4 or 5 minutes or so to have a poll. So asking you, I would like to get some questions and some feedback from you. So the polls, like Austin said, they're completely anonymized, so we won't know who responded to what. If you don't want to respond, then please don't feel a need to. It's entirely up to you whether you want to respond or not. So let us first start off with what is fatigue. We know it's a very common symptom among stroke survivors. I can tell you that it's not only present in stroke survivors, but is also present in a number of other neurological disorders. It's a very common symptom in multiple sclerosis. It's a very common symptom in Parkinson's disease. It's a very common symptom post-viral infections. And now with the current COVID-19 pandemic, what we're seeing coming up is that there's a lot of people that have had or fought the infection that are now complaining of chronic fatigue as a lasting symptom after all other symptoms have gone away. So fatigue is described usually as a feeling of extreme tiredness. We know it has a very severe impact on the quality of life after stroke. It's quite debilitating. It doesn't allow you to go about your day-to-day activities as you wish. And I can tell you that it's characterized as one of the top unmet needs for chronic stroke survivors. So when stroke survivors are asked, what would you sort of consider a #1 priority for further research, fatigue is something that comes up very often. So what I wanted to do is basically just to start off with is to launch the first poll, which is basically asking you a few questions. As part of the first poll, there's 4 questions I'll give you about a minute or so to respond. So I've just launched a poll now. And I want you to tell me whether fatigue is a problem for you after your stroke, whether you consider it to be amongst, let's say, your 3 most disabling symptoms, whether you get fatigue from doing nothing, whether it just comes about after a good night's sleep, for example, and how does it vary from day to day? Is there sort of some form of pattern to your fatigue? Do you have good days? Do you have bad days? How does it vary? So that was sort of something that we're interested in to see and to show you as stroke survivors how common fatigue is for everybody. Maybe another 10 seconds or so, and then we can move on and talk about this. Okay, so I mean, we've had now, there is currently 58 participants in the room, and we've had 36 response. And we can see that to the first question, whether fatigue is a problem for me after my stroke, 100%. So everyone said yes. So this shows clearly how common an issue fatigue is after stroke. To the second question is whether fatigue is among my 3 most disabling symptoms after my stroke. The majority said yes. 64% said it is one of the 3 most disabling symptoms, which is again in line with evidence showing that fatigue is something that really affects stroke survivors. And 17% said it's the most disabling symptom. So it is very, very sort of debilitating in that sense. I often get fatigued when I'm not doing anything. Again, the majority, 75% yes. So again, this is in line that shows that fatigue is something that can come up even after a good night's sleep, even when you're at rest. And then the last question is that my fatigue varies from day to day without any pattern. I can have good days, but I can also have very bad days. 86% respond yes. So again, we know that fatigue varies from day to day, and based on your responses, we can see that that is the case. So, given that fatigue is such a prominent symptom, then why do we know so little about fatigue? Why is there no treatment at the moment? Why is there no evidence as to what triggers fatigue? And one of the biggest barrier to studying fatigue is a terminology used to study it. So when you use the term fatigue, a lot of people associate the term fatigue with exercise-induced fatigue, that you've done too much, that's why you're tired, rest, you'll recover. We know that this is very different. That's fatigue after a stroke, in the sense that it's chronic fatigue and it's not induced by exercise. I mean, it's very evident from the poll that you can feel tired even when you're not doing anything. So there is a distinct difference between exercise-induced fatigue that has been studied for years and years, and we know what happens there, but we know very little as to why is there sort of fatigue when you haven't done anything? Why does it just come up even when you're sat at rest? And in terms of exercise-induced fatigue, you've done something, there are changes happening in your muscles, which then send signals to your brain, which sort of make you feel tired. But that's not the case after a stroke. So we can see that even in sort of fully recovered stroke survivors that have no sort of weakness, to put it sort of, they have no weakness, they can still feel fatigued. So there's a distinct difference between the two. And the terms we use to describe it is one of the barriers in terms of why we study fatigue. One of the other barriers for studying fatigue is that there is a lot of overlap with other affective symptoms. So what I mean by affective symptoms symptoms such as depression, chronic pain, sleep disturbances. And it's estimated that approximately 70% of stroke survivors will suffer from fatigue at some point after their stroke. And from the poll, if I remember correctly, 67% said that is one of the 3 most disabling symptoms. And of those, a large majority will also suffer from depression, from chronic pain or sleep disturbances. And up until recently, and when I say recently, I mean in the last sort of 15 years or so, fatigue was considered to be a secondary symptom, meaning that people would go to their neurologist or to some healthcare practitioner, describe that they're constantly feeling tired, and they were saying, they were given advice saying it's given that you're tired because you're depressed. So let's treat the depression, the fatigue will go away. But we know very clearly that that's not the case. We know that fatigue can exist independently of all of these other symptoms. So in the last sort of 10, 15 years, the idea behind fatigue is starting to change. It's starting to be more acknowledged as a common symptom, not only after stroke, but like I said previously, in a number of neurological disorders. And therefore, any sort of research should be focusing on purely fatigue and not these other symptoms. So just for now, if we can sort of launch the second poll, which is basically giving us ideas of whether the majority of you described, or 100% of you said that fatigue is a problem for you. And we want to see, just as in the current sort of session, the current webinar, there's currently 59 of us, how many of you have sort of have a problem in terms of other symptoms together with your fatigue? So whether it be sleep problems, whether it be chronic pain or depression. And so I've just launched a poll now. And if you don't have any of these other sort of symptoms, but purely have fatigue, then there's no need to respond. Yeah, so just don't respond if there is I should have added the none option there. Sorry about that. Okay, so we'll end the poll there. So at the moment, 29 people responded to this poll, whereas 37 responded previously. So I'll assume that if 100% said that fatigue, or 100% of those 37 said fatigue is a problem for you, then it means that 8 of you have no other symptoms. So it's purely fatigue, which again is in line with what we show, that fatigue can exist independently of other symptoms. And this sort of idea that fatigue was a secondary symptom to something like depression, well, in this case, only 17% said that they also have symptoms of depression together with their fatigue. So again, this ideology of fatigue being secondary to depression, we're moving away from it, and that's how it should be, because they are distinct symptoms. They do share common pathways within the brain, but they should be treated independently of each other. And the most common one that comes up in terms of other symptoms is sleep problems. So now, whether it's the fatigue that causes sleep problems, because we know that in cases of extreme tiredness, it's actually very hard to go to sleep sometimes, or whether it's the sleep problems that drives the fatigue, that's something that sort of we're currently, not only in our research, but other research groups around the world are trying to tease out. But we believe primarily it's the fatigue that's causing the sleep problems rather than the other way around. So there's also a number of different other factors which make fatigue very difficult to study. So putting it in the perspective of a stroke, so it seems to be irrespective of lesion location. So it doesn't matter where in the brain you've had a stroke. Fatigue is common in sort of the majority of lesions. It's common in both types of stroke. So whether it be an ischemic stroke, so a blood clot, or a hemorrhagic stroke, which is a bleed, it seems to be common in both types of strokes. It's irrespective of the type of stroke. It seems to be irrespective of gender, although there's some research suggests that it affects females slightly more severely than it does males. But again, that's not conclusive evidence. So it can affect both males and females equally. It's irrespective of age. So fatigue can affect younger stroke survivors as much as it affects older stroke survivors. Again, there's some evidence to suggest that there's a higher prevalence in younger stroke survivors. So whether that's to do with sort of the lifestyle differences, that's still not clear, and this evidence is not conclusive. There is no obvious trigger. So there's nothing clearly, given that it's so widespread across sort of the majority of stroke survivors, where stroke in itself can be so different between individuals. There is no clear trigger that results in the symptom of fatigue. And what's also very sort of strange in that we know why fatigue occurs in the first sort of weeks or months after a stroke. So once you've had a stroke, it's a major disruptive event. There are major changes happening, both within the brain, but also in terms of lifestyle changes. So it's normal to feel fatigue in the first sort of couple of weeks after your stroke, let's say the first month after your stroke. But the problem arises when it starts becoming a chronic problem. And that is what we're sort of referring to now. It's chronic fatigue. So why does fatigue persist 6 months, a year, 10 years down the line after the stroke? Once all other symptoms once everything has stabilized, why does fatigue persist? And we know that for a fact that fatigue can affect stroke survivors for 20 years after their stroke. So how do we sort of go about studying fatigue? Well, one of the reasons, again, one of the limitations, so now I've been talking only about barriers to studying fatigue, is that it's a subjective experience. So you rely on someone to describe their fatigue to you and tell you how they experience it. And we know that it's not all or nothing, and it can vary in severity. Like you said before in the first poll, you can have good days, but you can also have very bad days. And it's not you either have fatigue or you don't, it varies in severity. So therefore, if you were to come and study, if I was to study fatigue with some individuals, if I got you on a good day, asked you, how fatigued are you today? You would say, well, it's not a problem for me today because maybe one of my good days. But if I was to ask you the same question on a different day, then you'd get sort of a completely different response. And that's, again, one of the difficulties in studying it. And how we go about quantifying it is by asking questionnaires. So it's very questionnaire-based. So we ask you, how has fatigue affected your day-to-day living in the last week, for example? And that will sort of give us an idea as to how has it affected your sort of quality of life, or how does it affect you going about your day-to-day activities. And that's actually one of the reasons why it hasn't been acknowledged or recognized as a common symptom after a stroke, not only by healthcare professionals, but by employers, by carers, by all sorts of issues. And one of the things that's come up very, very often is that we've been asked, well, why haven't I been told about fatigue when I had my stroke? Or why hasn't my neurologist or my carer told me what's the best way to manage fatigue? And the majority of people are left on their own to try to figure out how can they go about managing their own fatigue, to find out more information about fatigue. And this is sort of one of the polls that I wanted to ask, because it's something that's very interesting and something that comes up so often, but yet it's not being recognized. So the next poll is sort of 3 questions. It's relating to whether your fatigue has been explained to you by your healthcare professional and how best to manage it, whether it's been acknowledged by your family carer. And then also another thing that comes up very often is a lot of people have actually went on to seek legal advice. So this is a lot very common among young stroke survivors, where they're expected to go back to work after their stroke because they look well, but yet they say to their employer that, well, I can't actually work because I'm really tired. And that says, I mean, that's not accepted by the employers. And that's something that we're sort of trying to address, in that it should be acknowledged as a symptom, and people should be aware of this as one of the limiting factors in terms of returning to work. Okay, stop the poll now, if everyone's happy. Yeah. So what we see in regards to the first question, I mean, we've had 34 people respond to the poll. Whether fatigue has been explained to you by a healthcare professional as a common symptom after a stroke and how best to manage it. The majority, 68%, said no. 23 people out of the 34, which is a very large percentage. I mean, given that how common a symptom it is after a stroke, it just shows that in terms of clinical practice, it's still far behind. So what we're trying to do is trying to push towards making people aware that fatigue is something that can occur after a stroke. And there are different ways. I mean, there's no current effective treatments for it, but there are ways to manage it. And this is something that people should be advised early on after the stroke. Otherwise, you're sort of stuck in this vicious cycle where your fatigue, rather than sort of not necessarily getting better, but not experiencing fatigue as much because you're learning how to manage your day-to-day activity, then they're sort of going about their normal day as they would previously, and then fall into this phase of extreme fatigue. Is fatigue acknowledged by your family, carer, and or healthcare professional? So the majority, 71%, said yes. But there's also still a significant amount that said no. Again, given the prevalence of fatigue, this 100% should be saying yes to this question. So again, this just shows that there's still a lot of work to be done to sort of make people more aware or acknowledge fatigue, that it is there. And the last question is something that sort of was triggered by one of the Q&A, the questions that came up, is, have you previously asked for legal advice with regards to how your fatigue was handled by your employer and or other relevant individual? Again, the majority said no, but 3 of you, I mean 9%, so 3 out of the 34 said yes, which again shows that there are barriers to how fatigue is being handled. And again, that's to do with how well it's been acknowledged. So this is something that we're trying to, something we're trying to work on, which is in the recent project we did, which is to highlight the prevalence and significance of fatigue. And we did this by just completing a 6-month project. So the timing of the project was quite bad because we started a week before the lockdown was implemented. And this project was called Experiencing Fatigue. So what this project was, we brought together scientists, artists, and we had 2 groups of 6 to 8 stroke survivors. And what we wanted to do as part of this project was to define fatigue from a stroke survivor's perspective. So we used this, we either used sort of metaphors or various artistic methods to try to describe what fatigue means to you as a stroke survivor, and therefore try to come up with a better definition of what fatigue is. Because if you remember, if I said previously, the term fatigue in itself is confusing to many individuals. Maybe not to us because we refer to it so often, but to others, when you say the word fatigue, they immediately think about you've done too much, rest, you'll recover. So what we wanted to do as part of this project was to define fatigue, and sort of some of the metaphors that came up, which I really wanted to pick out because there was some interesting one. So this is a metaphor from one of the stroke survivors that described fatigue as, fatigue is a sparrowhawk appearing from nowhere, swooping down, grabbing its prey, leaving in its wake a trail of devastation and trauma. And the second one is, fatigue is the sound of interference on a radio, a confused mess of noises, unable to tune in to the correct station. So these metaphors of fatigue are very, very powerful in themselves. So it sort of gives you how fatigue is being experienced by a stroke survivor. And this allows us to sort of give us clear targets into where we should focus on our research, which might help us understand what causes fatigue and then how can we go about treating it. And the aim of this project was to sort of, at the end of it, to come up with an immersive installation. So come up with an immersive physical installation and then invite healthcare professionals, carers, researchers, policymakers to witness firsthand what it is like to live with fatigue. So to put them in these installations and sort of give them the experience of what a person, a stroke survivor with fatigue, lives like on a day-to-day basis. And that will influence, that will change how fatigue is being approached, not only as a symptom, but will also make, like I said before, make healthcare professionals more aware that fatigue is a symptom, what it's like to live with it, how sort of employers should be implemented within policy that fatigue is a limiting factor in terms of returning to work, and people should be given more flexibility because that's not the case for everyone. Unfortunately, given the current situation and the current pandemic, the physical installation will appear hopefully in the new year, but we're still planning to launch a web-based version in October. So at the end of the presentation, I'll sort of put a link to our website where all the information is usually put on there. So then with all of this, sort of with this project, then we can focus on our research on what stroke survivors describe. So the same case of sort of muffled noise on the radio, and explore how changes in parts of the brain relate to fatigue. And we use sort of a number of different techniques in our studies, and I'm not really going to go into our research. But what the ultimate aim of our research is to sort of come up with an effective treatment for fatigue, because at the end of the day, that's what the majority of stroke survivors that suffer from fatigue want. And in terms of, are there any current treatments out there? Well, at the moment, no. So there is some evidence that cognitive behavioral therapy works for some stroke survivors, but not for everyone. So it's not definitive. It's a similar case for drug studies. So there's been a number of drug studies trying all sorts of different drug studies, but the results have been inconclusive in the sense that it tends to work for some individuals and not others. And it doesn't seem to work more than what we call the placebo effect. So just the idea of getting a treatment can sometimes make it better. So there, at the moment, there's no real drug that does help for fatigue. And at the moment, the only way of treating fatigue, which is not really treating, is learning how to manage it. So this was what a number of stroke survivors told me in terms of once you identify the triggers and signs of your fatigue, then it's best to sort of plan your day, have your day pre-planned accordingly. And sort of that way, you know how things will go and what your limits are and what triggers your fatigue. So that's sort of the only, at the moment, effective way of managing fatigue is. And I would just like to know from the people in this room, whether, do you believe you can manage your fatigue? Or in terms of treatments, are you really looking for some form of treatment for your fatigue? So this is just almost the last poll here. Okay, so we'll end the poll here. So again, this clearly describes what is the general consensus amongst the majority of stroke survivors, is that it's almost 50-50 whether people can manage their fatigue or not. And that sort of tells us more about the nature of fatigue, and that its varied nature and how it can differ from person to person. But still a major problem. If 50% of the people in this room cannot manage their fatigue, it means that fatigue has a very severe impact on their life. But even the people that do know how to manage doesn't mean that it's not a limiting factor. You just know how better to manage it. So it really pinpoints to the point that it's something that we need to come up or design some form of effective treatment, because for looking at the second question, 65% of the people in this room are admitting that they are desperate for some form of treatment for their fatigue, because we know how debilitating it is as a symptom in itself. So we're hoping, as part of our current project, that we will come up with some form of effective treatment, that we are moving in the right direction. And it's not all sort of, I'm making it sound all gray, that we're not close to a treatment or there's nothing that we can do. It's not the case. As part of our studies, we did recently complete a study where we show that there is some form of intervention we can do which proves to reduce the feeling of fatigue. Again, it's not a long-standing treatment, and it's still at the very early stages of being researched. So we're hoping within the next couple of years that there will be some form of treatment being developed. So what I would like, I'm going to just on the chat, I'm not sure whether it's the best way to put it, I'll put the link to our website. There's a lot of information about our research there. And what I would like to do, because as we saw from the last poll, that the 50% really haven't found a way to manage their own fatigue, or are unable to manage their own fatigue. I would like to know if any of you would like to share what are the coping strategies, what are your strategies for coping with fatigue. So on the website is my email address. And then what I can do, if everyone is happy with it, of course, I'll keep everything anonymized, is then I can collate all this information, put them together in a document, and then I can talk to Austin about potentially putting it on the different stroke websites, or putting it on our website also, where people can then refer to this in terms of, okay, what are the strategies that work for others? Maybe they might work for me. So if you're happy to do that, please do send me anything via email, and then I can try and put it together. Or if you want to have any form of conversation or any questions relating to the talk, and you don't want to raise it now in the Q&A, just please do send me an email. So I've just put the website there. There's all the information on the website. And I think that's it from me from now. So I think we'll go to for a Q&A. Try not to make the talk too long.
Thank you, William. That was absolutely fantastic. We've had a lot of great comments come through, and a number of questions as well. And I'll get to that shortly, but we did also have some questions that were sent through to us in advance. And I guess to start with the first question, which is kind of one of the most common ones that we get asked, which does post-stroke fatigue ever go away?
It does. It does in some individuals, but not in others. And again, we don't know why that is the case. So as part of our research, I've had a person that took part in 2 of our experiments. The person came in, described very severe fatigue. And then when she came back, I think 6 months later for a completely different experiment, she said that she woke up one day and the fatigue went away. Why that is the case, we don't know. And it doesn't seem to happen very often. So it can happen in some individuals, but it's something that doesn't happen commonly. And that's why we need to come up with an effective intervention or effective treatment for treating fatigue, because the number of people where it just goes away, it's very low.
Thank you. Next question is, Why am I always tired, even after just having a nice coffee morning with friends? I tend to come home exhausted.
Again, this is something that we saw from one of the polls, that it's unfortunately this chronic nature of fatigue can come up even when you're at rest. So we know a lot of people report that you can wake up after a good night's sleep. You've had a very good night's sleep, and you still wake up feeling extremely tired. Why that is the case, again, we don't know. We believe there are some sort of mechanisms, or somehow how the brain operates appears to be different in stroke survivors with fatigue in comparison to stroke survivors without fatigue. And what we're mainly focusing on our research is how information within your environment is being processed. So everything feels, in a way, how to describe it, overwhelming. So we know that this feeling of feeling overwhelmed or not able to filter out information within your surroundings, this can also happen at rest. So with like having a cup of coffee, it's like an activity which doesn't require much effort, but can leave you feeling exhausted, like this person described. So it might be to do with how you filter out your environment, which leaves you exhausted. And this is something we're trying to identify as part of our research. At the moment, there's no clear answer to that, unfortunately.
Thank you. You touched on sleep there, and one of the questions that we've had come in on the Q&A today is if you recommend maintaining a sleep or fatigue diary.
Yeah, so that's something that actually tends to help. And this is what I know from my interactions. So in the last 4 years, I've been working on fatigue for the last 4 years. And in the last 4 years, I've seen probably close to 300 stroke survivors. And every time we sort of have a conversation about their own fatigue, how they manage it, or if they can't manage it. And one of the things that comes up is managing your day-to-day. And what it is keeping sort of a very strict schedule, or relatively strict schedule, in terms of sleep patterns, fatigue patterns. And that's sort of having these sort of diaries helps you then identify what your triggers are, what your signs are. And therefore, once you identify these, then you can sort of manage your day, have a more structured day, which will then sort of, in a way, limit or reduce how often fatigue then becomes a major issue.
Thank you. Has medication been used to help with fatigue, and is there any evidence that this is of value?
So we sort of touched upon this lightly, and it's something that, because drug studies in general, there's a big push from pharmaceutical companies to sort of develop drug studies for very common symptoms, one of them being fatigue. And at the moment, as I know, there's been 5 very large drug studies targeted after stroke, and all of them have been inconclusive. So there is no clear evidence that some form of medication works. It might work for some individuals, but not for others. But if you want to then portray it as an effective treatment, then it has to work for the clear majority. And in this case, it doesn't. So I'm not really aware. I mean, as of now, I'm not aware of any medication that can actually significantly improve fatigue.
Okay, thank you.
Unfortunately.
We've had a couple of questions come in regarding exercise. Firstly, what evidence supports fatigue with regards to exercise post-stroke? And also, someone made a comment, my stroke doctor said I should exercise to help fatigue. What's your view on this?
So again, exercise is something that can help with some stroke survivors. And again, it's again learning, and what this fatigue diary can do is sort of allow you to pinpoint how effective exercise is for you. So if you go about doing exercise as you did previously, and it doesn't really leave you exhausted afterwards, then by all means, go ahead and carry on doing it. And it's always good to sort of identify these triggers. I know of a stroke survivor that took part in our research, which he's a very keen runner. He runs 5Ks, 10Ks, half marathons. He has no problem. That doesn't leave him fatigued. So this is sort of, it's very, there's a clear distinction between the exercise-induced fatigue, which can be triggered by sort of different forms of exercise, and the fatigue that you report after a stroke. So I would say it will vary from person to person, but it's key to identify what works for you as an individual. So if you exercise, whether it be high intensity exercise or low intensity exercise with many repetitions, if you do it and it leaves you exhausted afterwards, then I would advise against it. Try to do things that allow you to sort of still go about your day-to-day as they would have done previously. So it's a matter of, again, identifying what works for the individual. So it's not one size fits all, really.
Of course, yeah. In contrast, we've also had a comment and a question saying that mental activities tire me out far more than physical activities, and if I'm mentally concentrating on uni work, I'll be physically broken for the next few days.
Yeah, and again, that's something that clearly distinguishes the chronic nature of fatigue, or the fatigue that we're talking about now, and exercise-induced fatigue, where it's most commonly sort of used to describe the term fatigue. That we know that mental activities can be just as tiring for stroke survivors with fatigue as physical activities. And again, unfortunately, it's sort of, I'm sounding like a broken record here, but it's a matter of identifying what works for you and what your limits are. Because at the end of the day, fatigue is the final feeling you feel. What its triggers are, whether it be mental activity or physical activity, it doesn't really matter. It's then what you then describe as fatigue is that final sort of perception, that final feeling that you describe and that people try to understand. So it's learning how, again, what are your limits? Some people, unfortunately, you can't go around it. And some people, they have to push through these barriers, whether it be for uni work or whatever, and then spend the next 2-3 days trying to recover from this. So unfortunately, some days there's no alternative. And this is why we're trying to sort of, what I talked about with our arts project we did, is we're trying to sort of make people more aware that it is a symptom and that it's okay for someone to do, rather than spending a whole day in front of the computer doing sort of very intense mental work. Do it over 2 days, over 3 days, if possible. So yes, it's very common, but unfortunately it's just, again, keeping a diary, learning how to manage it.
Yeah. So just got time for a couple more questions. Do health professionals receive any training on advising patients about fatigue?
Recently, more. I'm not sure in the past, but we've been recently, myself and my supervisor, Dr. Anna Kuppuswamy, at least with different forms of therapists, whether it be physiotherapists, occupational therapists, speech and language therapists. We've recently had more and more sessions with healthcare practitioners to explain the nature of fatigue. We've done it also in a European conference last year, where it was a room full of healthcare professionals trying to describe the incidence of fatigue, what stroke survivors describe as part of our research, and how our research focuses to understand fatigue and come about effective treatments for fatigue. So I feel like recently there is more of that being implemented. Now, I'm not sure whether that was the case 5-10 years ago, but I know that now it's becoming a sort of a major topic for discussion amongst sort of scientists and healthcare professionals.
Thank you. And before I come on to the last question, just a couple of comments which are kind of related to the final question. Somebody's put, finally, I feel somebody gets it. I'm so tired of people not understanding fatigue and how it affects everything that we do. And it's also been commented, I had terrible problems with my employer accepting I had fatigue after my stroke. I look okay, so I must be okay to work full time, was the attitude. And I guess both of these comments in the area about a complete lack of understanding from people feed into the final question, which we have been asked many times before, and it's regarding universal credit. And the specific question is, are there any journal articles that would be best to take with me regarding fatigue when I need to be assessed by the universal credit doctor again?
Yeah, so this is a major point for discussion, and something that comes up in a lot of our meetings very often, in that a lot of stroke survivors which suffer from fatigue, some of them they're fully recovered. Their only symptom is fatigue. And again, they're expected to go back to work, because fatigue is something that it's like I said before, it's a subjective experience. You describe it. You can't diagnose fatigue from the outside. So there's been a lot of sort of back and forth, and we've had sort of legal cases where people have asked us to provide evidence that fatigue is something that's present, that they can share with, whether it be their lawyers or the universal credit doctor. So with journal articles, again, we have to be a bit careful, because they're purely for research purposes. It can be used as evidence, but it's by no means definitive evidence, because it's purely for research. And with the research articles, there is not much, most of them aren't accessible to everyone. So whether you need to have some form of institutional access or buy the journal. So whoever is in need of that, or whoever needs sort of journal articles to take with them in terms of when discussing with, whether it be the lawyer or university credit doctor in relation to fatigue, please email me, and I'm happy to share those articles with you, because I can access them and then send them directly to you. I think that's the best way to do it, because otherwise I can give you papers or sort of links to certain websites, but then you won't be able to access them. So I think maybe that's the best way to do it. But it's an issue that comes up very, very often.
Thank you. Well, thank you, William, so much for your time this morning. As I said, we've had some great comments by people, and we really appreciate you giving up the time to talk to us this morning about fatigue.
You're very, very welcome. It was a pleasure. It's something I can give back to the stroke survivors for all their time, and how many of them take part in our research it's what drives our research forwards. I mean, we wouldn't be able to do any of this work without the stroke survivors volunteering to do it. And thank you for putting this on.
Thank you. We'll just reiterate to people, if you would like to look at the chat function, you can see details of William's websites there, which is for effortlab.wixsite.com/fatigue. But please do have a look at that if you'd like to contact him through there. You can also always contact us at info@differentstrokes.co.uk. Again, I've put our email address in the chat function if you have any comments that you'd like to share with us about fatigue. Once again, thank you so much for your time this morning, and for everyone who's watching. We will have these webinars throughout the course of the week, so I very much hope to see you at following sessions. Thank you.